Bomma le botate, molokoloko wa dirutegi o tla tsena mo nakwaneng ye kopana. Le kgopelwa go ema.
Dames en here, die akademiese prosesie sal nou inbeweeg. U word versoek om asseblief op te staan.
Ladies and gentlemen, the academic procession will now enter. You are kindly requested to stand.
By virtue of the authority entrusted to me, I hereby constitute this assembly as a legal congregation of the University of Pretoria. During this assembly, degrees with all their associated rights and privileges will be conferred on the candidates whose names appear in the program. Please take a seat. Ladies and gentlemen, we now request you to join us in a silent prayer or meditation to give thanks to the achievements of our students. Thank you. Ladies and gentlemen, I would like to do a short welcome to the Vice Principal, Acting Vice Principal, Professor Sinkubuche, the Registrar, Professor Nicholson, the Dean of the Faculty, Professor De Jager, the Deputy Dean for Teaching and Learning, Professor Steenkamp, Deputy Dean for Research and Postgraduate Studies, Professor Mashamba Thompson. And I would also like to welcome our Assistant Director for Operations and Career Services, Ms. Lachranche, and to all chairpersons of schools, heads of departments, directors, professors emeriti, honorary professors, and everyone else in our lecturing staff. You are welcome to this very special ceremony. We are now going to experience one of those very special moments and to all the parents, guardians, students, friends, ladies and gentlemen, sponsors, welcome to this. We truly appreciate your joining us this afternoon. We are here to celebrate the achievements of our medical practitioners, or health professions rather, health practitioners. These accomplishments come a long way, and we know now you have crossed the finishing line, and it was as a result of hard work, of dedication, of commitment, of endurance, and we are now here. And I'm sure that I speak on behalf of everyone when I say that we could not be prouder of you. The mountains you have climbed, and you certainly stand out now, in excellence. And we truly wish you all the best. This is now a moment to reflect, that you take a pause, look back, when you've climbed that mountain and you look down and you remember the hardships you endured. And I'm sure that the qualification that you will receive today from the great university, the University of Pretoria, is a passport to an exciting future. Just be careful. When I say passport, I don't mean you should get into the aircraft and leave the country. You just stay here. We have many problems, you know them. And of course, in terms of our vision, because that's what a vision is, we look forward, we look back, we look forward, and we take very calculated risks, We have to embrace what we have and encourage and nudge and work with you under very difficult circumstances throughout your student life cycle at the University of Pretoria. And we know that beyond the boundaries of knowledge and of knowledge production comes the wisdom and the responsibility. So you have learned all the skills now, and we know that these are not going to benefit you alone. They will benefit everyone else in society, including your families. We produce graduates that are socially conscious. If you look at the kind of training that we have, you have to be aware of your surroundings and be active citizens and address societal issues, and there are many, and we do, of course, as far as we can, instill a positive attitude in our students to work with communities. And it is not easy in some of the communities to work there, and especially because our country has been turned into, I don't know how to describe it. You can describe it yourself, but it's not what we used to have. And so when you go out into the communities, the dean would scream at us from time to time that the safety and security of our students is compromised. So to be in this field is a huge responsibility. And it is one of those fields where you have to give, your life of service to others, Many years ago, when we were growing, when I started working at medical school, it was still service, but it was also, how to make easy money, quick. And you could see all of these people on campus advertising on a day such as this one, or when you take Hippocratic oaths with BMW and Mercedes and sinking our students in debt. So we don't have that now, because it's all about the human element, how you give to the communities, and you put yourself behind, not first. So we truly appreciate that. It is something that really makes us proud, because we know that from now on, you will continue to make a positive difference in the lives of many, many people, because many people are vulnerable, but the impact that you have is far-reaching. And we encourage you today to follow, the spirit, or the words, but mainly the spirit, really, of Nelson Mandela, our past president, who said, what counts in life is not the mere fact that we have lived. What counts in life is not the mere fact that we have lived. It is what difference we have made to the lives of others that will determine the significance of the life we lead. That was President Mandela. So, what counts in life, is not the mere fact that we lived. For those of you who know the Bible, there is an old man there. His name was Methuselah. Methuselah. So the only thing you have in the Bible about him is that he lived for a very long time. 969 years he was alive. We don't know what he did. He just lived for a long time. We're very happy to live that long, God gave him the grace to live for just under 1,000 years. So things have changed a little bit, that you have to make a difference. At least we should know that you are making it. So I wish to thank you for your sacrifices. We know that over the years, you have been making us proud, We know that there has been a number of disruptions, You also experienced the COVID challenges, and you were one of the groupings that were in the front line when this disease was ravaging us. And we wish to thank you for that. And we know that you have an attitude that says, we can do this, And as you go out, I'm sure that you will continue to make the University of Pretoria proud. And these problems that we have, which you will be tackling collectively and in partnerships, use your expertise. The kind of training that you got in this faculty is quite superior. We have, some of the latest technologies, and you've been through those labs, you've been through practice and other things. So we hope that, these superior technologies have made a difference that will of course, foster learning, that will help you do your job better in private. So the future workforce, that you are heading into is truly unprecedented. And we look forward to hearing, the kinds of advances, the transformation that you will be embarking on, and all the important role that you will be playing. We know that you have experienced lifelong learning. You are still going to continue, because you cannot be in this profession if you don't learn forever. This is just one of those steps that enable you to look into the future, apply your skills, help others, and help the country with all of our problems. And this is a new generation of leaders, and we look forward up to you. Those of us who are old, will be retiring and looking for a doctor. And many years ago, there's a woman that got involved in an accident. I have to say this again, and it was in another province. And as people were gathering to assist, she was still conscious, and so there was a doctor that stopped by, and it was very nice, you know. So they said, no, at least there's a doctor here who can help you quickly and resuscitate. And then she asked the question, like, where did the doctor graduate from? And the doctor said, from institution X. And she said, no, please find me a priest to pay for me. I cannot trust doctors from there. So, and as I conclude, I'm sure that the number of graduates, PhD graduates that you see here and postdoc fellows, you know, and all the grants that we've been having, you know, it's some of that impact that we have in society. Because if you don't make an impact, you know, then that means you are not there yet. So you have to be known for having done something or doing something that makes a difference in your surroundings. So ladies and gentlemen, I'm sure that all these top scientists that we have here on the stage and elsewhere, you know, have done the best that they can. And I also wish to thank them very much, the faculty, its management, you know, the dean and managers and everyone else that make the campus look as beautiful as it is. We know that in your own way, you have contributed to this achievement that our student has. And I'm sure that as we conclude that you will have a joyous day. You will celebrate with family and friends. You will keep in touch with the university. Don't forget us. That is if you are leaving, because you'll make a bit of money, remember. So it would be very nice if you could, small make a contribution to assist other students. So when you start making a bit of extra money, as I say, just remember, it doesn't have to be a lot, but just enough to assist others. And Mr. Dean, Mr. Registrar, Vice Principal, and audience, I wish to thank you very much for your indulgence. We will now request the Dean to introduce to me the candidates whose names appear in the program.
Mr. Interim Vice Chancellor and Principal, the supervisors will now introduce the doctoral candidates from the School of Medicine.
Mr. Interim Vice Chancellor and Principal, I introduce to you Eric Mensah, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled Antimicrobial Synergistic and Autophagic Effects of Medicines for Malaria Venture Pathogen Box Compounds on Resistant Strains of Mycobacterium tuberculosis and Neisseria gonorrhoeae, prepared under my supervision and with Professor Remco Peters as co-supervisor. In his thesis, the promovendus explored the antibiotic potential, synergistic action, and autophagic effects of a series of novel compounds selected from the Medicines for Malaria Venture Pathogen Box when directed against Mycobacterium tuberculosis and Neisseria gonorrhoeae, two priority pathogens of global concern to public health. 8 of these compounds showed potent bactericidal activity against resistant strains of Neisseria gonorrhoeae, including synergistic activity with ceftriaxone. Another 5 compounds showed bactericidal activity against susceptible and multi-drug resistant Mycobacterium tuberculosis strains. For these compounds, Synergistic and additive killing activities were also demonstrated when combined with isoniazid or rifampicin, two key first-line antibiotics commonly used in the treatment of tuberculosis. Low toxicity and autophagic effects in host cells were observed. This apparent dual action in suppressing the growth of intracellular Mycobacterium tuberculosis by killing directly the organism and simultaneously enhancing autophagy in the host cell is a unique and highly significant finding. Overall, the antigonococcal, anti-TB drug leads identified in the work presented here are worthy of further exploration. Mr. Interim Vice-Chancellor and Principal, I request you to confer the degree on the candidate.
I hereby confer the degree, Doctor of Philosophy with all its associated rights and privileges on the candidate.
Mr. Interim Vice-Chancellor and Principal, I introduce to you Roy Muzivakanu Mlambo, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled Towards the Development of a New Technique for Mastectomy Scar Electron Beam Treatment using a Variable Colorimeter and Computer-Automated Treatment Table Protocol, prepared under the supervision of Professor A.R. van Rensburg. In this thesis, the candidate aimed to develop an alternative treatment technique for mastectomy scars. This technique employed a variable colorimeter and computer-controlled treatment table to treat breast cancer patients using electron beam radiotherapy. Post-mastectomy radiotherapy often includes a mastectomy scar electron boost to enhance local control and disease-free overall survival. Electron beam radiotherapy minimizes the dose to the underlying normal tissue beyond the target volume while ensuring a more uniform dose distribution. The proof of concept involved the development of a treatment technique designed for breast mastectomy scars, incorporating a variable colorimeter and an automated treatment table. The proposed treatment technique was found to be a viable option for treating patients who have undergone mastectomy and require radiotherapy treatment for the mastectomy scar. Mr. Interim Vice-Chancellor and Principal, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate.
Mr. Interim Vice-Chancellor and Principal, I introduce to you Dorcas Umaga, who has complied with all the requirements for the degree Doctor of Philosophy with a thesis titled Assessment of Bunia viralis Activity and Circulation in Humans, Livestock and Peri-domestic Rodents in Diverse Ecologies in Kenya. This was prepared under my supervision and with Dr. Rosemary Sang and David Tekausi as co-supervisors. In this thesis, the candidate aimed to determine the prevalence and characterize Bunia viralis in febrile patients, domesticated livestock and peri-domestic rodents in diverse ecologies in Kenya. Using cross-sectional field and lab-based studies, she determined the prevalence of several phlebiviruses, Bunia viruses, hantavirus, and Crimean Congo hemorrhagic fever, and isolated Nagari virus for the first time in livestock in Kenya. The study provides data on circulating Bunia viralis that could contribute to human and animal disease burdens, highlight the importance of One Health disease surveillance in understanding virus transmission and dynamics. The application of sequence-independent screening methods included virus isolation and next-generation sequencing also led to identification of a novel orbivirus named Katombes virus, previously unknown to circulate in cattle. Mr. Interim Vice-Chancellor and Principal, I request to you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate.
Mr. Interim Vice-Chancellor and Principal, I introduce to you Kimberly Tando Peter, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled Influence of Mesenchymal Stromal Cells and 2-methoxyostradiol in a murine model of spontaneous mammary carcinoma, prepared under my supervision and with Prof. Mike Pepe and Dr. Krishna Duran as co-supervisor. In this thesis, the student explored alternative therapies for breast cancer by investigating the effect of mesenchymal stromal cell therapy and the chemotherapeutic agent 2-methoxyostradiol on breast cancer development using an isogenic mouse model. Mesenchymal cell treatment showed an anti-tumor effect on pulmonary metastatic breast cancer by increasing necrosis and CD3 T cells while decreasing the number of anti-inflammatory macrophages. Additionally, the students showed the effect of 2-estradiol varies in the different stages of breast cancer development, revealing differential effects on tumor necrosis, cytokines level, anti-inflammatory macrophages, and T cell presence. The findings shed light on the potential beneficial anti-tumor effects of mesenchymal stem cell in pulmonary metastatic breast cancer and the stage-specific efficacy of 2-methoxyostradiol, particularly in late-stage breast cancer. Further exploration of these treatment options is essential for developing targeted therapies for breast cancer at various stages of progression. Mr. Interim Vice-Chancellor and Principal, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate.
Mr. Interim Vice-Chancellor and Principal, I introduce to you Riabetswe Rosie Pitere, who has complied with the requirement for the degree Doctor of Philosophy with the thesis titled The Role of Solid Carrier Family 7, Member 8 in Adipogenesis in vitro and in a murine model of diet-induced obesity, prepared under my supervision and with Prof. Mike Pepe as co-supervisor. In this thesis, the students showed that mice that do not have this gene were significantly protected against diet-induced obesity, which was characterized by reduced adipocyte hypertrophy, reduced lipid accumulation in various organs, and improved glucose metabolism. Plasma levels of adiponectin and anti-inflammatory cytokines increased, while those of leptin and pro-inflammatory cytokines decreased in the knockout model. The findings demonstrate that metabolic health was improved and the inflammation associated with obesity development was reduced in the knockout mice, in addition to a significant decrease in macrophage infiltration into the adipose tissue. Furthermore, inhibition of this protein function suppresses adipogenesis and promotes browning in the white adipose tissue. These findings demonstrate this gene is a potential therapeutic target for preventing obesity development. Mr. Interim Vice-Chancellor and Principal, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate.
Mr. Interim Vice-Chancellor and Principal, I introduce you to Ms. Barbara Stroe van Deventer, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled Development of a Cardiac Channel Molecular Autopsy in a South African Cohort of Sudden Unexplained Deaths in the Young, prepared under my supervision and with Dr. Lorraine de Toy-Prinsloo as co-supervisor. In this thesis, the candidate investigated inherited cardiac arrhythmogenic disorders as a possible cause of sudden, unexpected deaths in persons under the age of 40. The candidate custom designed a panel consisting of 49 genes, which was screened using next-generation sequencing technology for variations linked to these cardiac disorders in cases admitted to and examined at the Pretoria Medico Legal Laboratory. Likely pathogenic variations were identified in 10% of the study cohort, allowing for assignment of a probable cause of death in these previously unexplained cases. Finally, a more cost-effective, targeted genetic test specific to the South African population was suggested for routine testing in all sudden death cases, as well as their at-risk family members. Mr. Interim Vice-Chancellor and Principal, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate.
Mr. Interim Vice-Chancellor and Principal, the following candidates have complied with all the requirements for the degree Master of Medicine in Anesthesiology. Ingela Kuhn. Michelle Parsons. In internal medicine, Ndubuvu Kwashaba.
Face me, okay? Head down. Congratulations.
Also in internal medicine, Danielle Nanek.
Well done.
Willie Nell with distinction. In medical microbiology, Rosemary Griesel. In neurology, Bongani Ngele.
Face me. Face me. Yeah.
In neurosurgery, Mpalagadi Nkabeleng. Vusimusi Khadebe. In obstetrics and gynecology, Martha Siloka. Makusandile Tukani. In orthopedics, Jan Makwela. In otorhinolaryngology, Mbuti Lumata. In pediatric surgery, Kenile Kumba. Pediatrics, Vanita Bueta. I apologize, she almost got the wrong degree, VC. In psychiatry, Vanita Bueta. Also in psychiatry, Sinuvivu Msutu. In surgery, Marguerite Barnard. Dandazwa Michikika. Nana Akuya Ose Kufur. Unita Singh. In urology, Kayaletu Tlamini. Mansu Tsohahu. Master of Science in Anatomy, Riabetswe Konyane. Timbikile Nkuzangwe. Nicole van Heerden with distinction. In chemical pathology, Esther Zoe with distinction. In human physiology, Roxane Cronje. Alex Marais with distinction. Karabu Ratebe. Ivan Sipsma. In medical immunology, Lebogang Sekalo. In medical microbiology, Shanae Buys with distinction. In medical oncology, Mandisa Mbeji. In sports medicine, Kobus Slabber with distinction. Master of Science in Sports Science, Biokinetics, Lisa Kroon with distinction. Mr. Interim Vice-Chancellor and Principal, the following candidates have complied with all the requirements for the degree Bachelor of Science Honours in Human Physiology, Mahlaku Molomo. In medical microbiology, Zander Niaus. In medical physics, Tsegofatsu Maswabela. Mr. Interim Vice-Chancellor and Principal, the following candidates have complied with all the requirements for the Bachelor of Medicine and Surgery. Abil Baizaem Yamungu. Kagiso Dlamini. Nasreen Ibrahim. Kaylin Lorick. Nomfundo Mataba. Khomotso Matibela. Andisa Nimaun Khani. Refilwe Motaung. Londiwe Ndlovu. Noluntandu Ndlovu. Anile Makatswa. Bianca Niemand. Joseph Ukelo. Liani Oosthuizen with distinction. Tabu Bapu. Lizanne Roux. Luyanda Zwane. Mr. Interim Vice-Chancellor and Principal, the supervisors will now introduce the doctoral candidates in the School of Healthcare Sciences.
Mr. Interim Vice-Chancellor and Principal, I introduce to you Christine Lingi Mantepa Mabena, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled Communication Guidelines to Support Grandparent-Headed Families Regarding Sexual Reproductive Health in Tshwane District, prepared under my supervision and with Prof. T.I. Ramaboya and Prof. M.M. Raswese as co-supervisors. The candidate used a qualitative, phenomenological, and descriptive method to explore and describe the experiences of grandparents, grandchildren, and primary health care nurses regarding sexual reproductive health promotion. The method yielded findings that may assist primary health care nurses to promote sexual reproductive health communication. Delphi technique was used to develop guidelines to assist in communication. The findings suggested the following: practicing sexual reproductive health communication, factors facilitating sexual reproductive health communication will be enhanced. The use of collaborative efforts will strengthen sexual reproductive health. Creation of an enabling environment is key to reduction of sexual reproductive health problems. Mr. Interim Vice Chancellor and Principal, I request you to confer the degree on the candidate.
I hereby confer the degree, Doctor of Philosophy, with all its associated rights and privileges on the candidate.
Mr. Interim Vice Chancellor and Principal, I introduce to you Nogia Elsama Chaba, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled Factors of Foodborne Diarrhea in Children Under 5 years of Age in Marakwane and Kamakakweni District, Maputo, Mozambique. Prepared under my supervision and with Prof. E. Salvador as a co-supervisor. The candidate investigated factors of foodborne diarrhea and developed a local strategy of preventive measures for foodborne diarrhea in children under 5 years. She applied exploratory sequential mixed methods and nominal group technique in 3 study phases. Phase 1 assessed the practice of health professionals in diagnosing and treating foodborne diarrhea. Phase 2 explored and described the household factors associated with foodborne diarrhea. Based on the results and findings of the first 2 phases, a local strategy to prevent foodborne diarrhea was developed in phase 3. The findings show that children with diarrhea were treated with antibiotics without screening for the etiological agent. At the household level, the factors associated with foodborne diarrhea were using traditional medicine, bottle feeding, and inappropriate water consumption. The developed strategy could be used by different stakeholders involved in the prevention of foodborne diarrhea. Mr. Interim Vice Chancellor and Principal, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate.
Mr. Interim Vice Chancellor and Principal, I introduce to you Takalani Ellen Mbetsi, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled Development of a Psychoeducational Program for Family Members Caring for Mental Health Care Users in Vembe District in Limpopo Province, prepared under my supervision and with Prof. Moagi as co-supervisor. In this thesis, the candidate developed a psychoeducational program for family members caring for mental health care users in Vembe District in Limpopo Province. The research was conducted in 3 phases. The first phase employed qualitative individual interviews to determine the needs of family members. The second phase used a nominal group technique with community stakeholders to focus on developing a psychoeducational program to support family members. In the third phase, a Delphi technique with a panel of mental health experts was employed to refine the program and reach a consensus on the interventions, outcomes, and resources. The findings suggest that family members caring for mental health care users need physical, psychological, social, financial, spiritual, and healthcare support. These needs are addressed in the psychoeducational program through community-based educational and interprofessional healthcare interventions to reduce the care burden experienced by family members. Mr. Interim Vice-Chancellor and Principal, I request you to confer the degree on the candidate.
I hereby confer the degree, Doctor of Philosophy, with all its associated rights and privileges on the candidate.
Mr. Interim Vice-Chancellor and Principal, I introduce to you Krista Scholes, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled Development of a Clinical Measurement Tool for Measuring Voluntary Eye Movements in Typically Infants 6 months of age, prepared under my supervision with Professor Rika Hanchraz as co-supervisor. In the thesis, the candidate developed and tested a tool for measuring voluntary eye movements in typically 6-month-old infants. Eye movements are intertwined with infants' visual performances for the development of perception and optimal participation in everyday activities. Observable, measurable indicators were generated for this age group, and test materials were developed accordingly and constructed. Content validity was established, and a pilot study confirmed that the voluntary eye movement test reflected the capability of typically developing 6-month-old infants in a naturalistic interaction with persons, objects, and the environment. The tool is able to differentiate typical from atypical development, and the outcomes will support occupational therapists in planning intervention for infants with developmental difficulties and provide guidance for families. Mr. Interim Vice-Chancellor and Principal, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate.
Mr. Interim Vice-Chancellor and Principal, I introduce to you Kenny Johannes Sibutuma, who has complied with the requirements for the degree Doctor of Philosophy, with a thesis titled Development of Health Promotion Interventions for Families Having Members Diagnosed with Tuberculosis in the Northwest Province, prepared under Prof. Peu and myself with Prof. Moahe from the University of Northwest as co-supervisors. In this thesis, the candidate aimed to develop health promotion interventions for families having members diagnosed with TB in Northwest. Phase 1 of this thesis explored and described the experiences of families having members with TB, as well as the needs of community health nurses with regard to TB health promotion programs. The findings of this study highlighted that a family-centered approach is crucial as members are taking care of TB patients at home. The family members needed to be empowered with adequate information to take good care of their loved ones. The findings of this study showed that there were 6 health promotional interventions which were developed using Delphi. And these interventions also supported the community health nurses in their interventions to improve the quality of health care to TB patients and their families. Mr. Interim Vice Chancellor and Principal, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate.
Happy World Physiotherapy Day to all the physiotherapists in attendance today and graduating. Mr. Interim Vice Chancellor and Principal, I introduce to you Makwena Maidasibui, who has complied with all the requirements for the degree Doctor of Philosophy with a thesis titled Development of a School-Based Framework to Support a Toolkit for Learners with Physical Disabilities in Limpopo Province, prepared under my supervision with Dr. Mshunani and Dr. Chavalala as co-supervisors. In her thesis, the candidate developed a framework to support the implementation of the Screen, Identify, Assess and Support policy for learners with physical disabilities in special schools within Limpopo Province, employing a parallel convergent mixed method research design with a dialectical pluralism approach. The study documented experiences from educators, school-based support teams, physiotherapists, and caregivers. The research uncovered several challenges, including inadequate knowledge among stakeholders and a shortage of physiotherapists, leading to suboptimal identification of learners' barrier and unclear support strategies. The developed framework aligns with a knowledge process model. It underscores the pivotal role of physiotherapists in the CS process and the significance of interprofessional collaboration to enhance knowledge and support provision. Notably, this framework marks a pioneering effort in Limpopo Province within the realm of inclusive education and holds substantial promise for improving the educational experience of South African schools. Mr. Vice Chancellor and Principal, I request you to confer the degree on the candidate. Congratulations.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate. Well done.
Mr. Interim Vice Chancellor and Principal, the following candidates have complied with all the requirements for the Master of Science in Applied Human Nutrition. Vanessa Udedi. Master of Nursing Science, Nursing Education, Estelle Bester. Mamoketi Dihangwane. Ayanda Kumalu. Elelwani Malau. Iterileng Motsekhai. in Nursing Management, Tracy Quinaiti. Libuwani Netshia. Master of Nursing in Clinical Field of Study, Natasha Hubert. Nene Makau. Mosima Mamabolo. Shirley Masinya. Rose Ukelo. Bongani Tabede. Vonani Chirandu. Master of Occupational Therapy, Mpakileng Apane. Juveria Baruch. Marika Smit. Mr. Interim Vice-Chancellor and Principal, the following candidates have complied with all the requirements for the degree Bachelor of Nursing Science, Education and Administration, Nursing Management, Timbisile Mtombeni, Bachelor of Occupational Therapy, Zandin Pascal. Mr. Interim Vice-Chancellor and Principal, the following candidates have complied with all the requirements for the Master of Science in Dentistry. Ilana Middleton. Mr. Interim Vice-Chancellor and Principal, the following candidates have complied with all the requirements for the degree Bachelor of Dental Surgery. Anine Pretorius.
Let us give our graduates a big hand. And listen carefully now, because I know what happens here. Now we'd like to ask our graduates to applaud their families, friends, parents, spouses. I knew it. People who didn't pass here will also applaud, but that's nice. It's a celebration after all. Now, ladies and gentlemen, we have come to the end of the proceedings, and I would like to thank you very much with your cooperation for us to finish this. I also want to thank load shedding for respecting us for now. So now we are going to request you to rise and remain standing for the singing of the national anthem. Can we finish first? Then we can be happy. By the powers vested in me, I hereby dissolve this assembly of the University of Pretoria. Thank you.